Come in.
Hello, how's it going?
Pretty good.
Good. My name is Hussein. I'm gonna be your nurse today. I'm gonna do a head-to-toe assessment. I'm gonna go ahead and provide privacy. Close the curtain. And I see that you just wore a gown, so that's good. Can I see your armband? All right. What's your name?
Angie. Washer.
Date of birth?
9/12/75.
All right. I'm just gonna wash my hands really quick. All right. So tell me, why are you here today? What brings you here?
I'm just getting a physical.
Okay. Okay. So again, I'm gonna do a head-to-toe assessment, and it's always good to get it every 6 months. I'm gonna ask you a couple of questions. Do you know where you're at right now?
Yes, I'm at the doctor's office.
Do you know who's the president?
President Trump.
All right. So right now I'm just checking for orientation. She's 8 times 4. She's responding to my questions, and she looks alert and oriented. Okay, Angie, do you have any allergies to any medication?
Nope, none.
All right. Do you like to go by Angie?
Yes, Angie
Okay.
would be fine.
And is it okay if I can touch you?
Yep.
All right. Do you want to use the restroom or
Nope, I'm
before
good.
we start? Okay. I'm gonna go ahead and do your blood pressure and vitals. We'll
Okay.
get that going so we can get a baseline. Wash my hands again. I'm gonna start with your blood pressure. Can I see your arm? I'm gonna warm the stethoscope. Great. It is 120/65. All right, I'm gonna check your pulse really quick. For a full minute. All right, so your pulse is 72, and I checked your respiration too. It is 16. And I usually do that while I'm doing the pulse. I want to check your temperature really quick. All right, 98.0. I will go ahead and throw that away. All right, I'm gonna take your O2 stats, your oxygen level. All right, it is 98. I'm gonna check your weight really quick. And while I'm checking your weight, I'm gonna document the vitals. Do you wanna step on the scale for me?
Yep.
All right, you're 150. Can you turn around for me so I can check your height? Hold on a second. Go ahead. Okay, so you are 5'8". Perfect. Can you have a seat for me? I'm looking at your overall appearance. You look very good for your age. You're alert and you're able to answer questions, and there's no delay in your speech or slurred. Your breathing is good. Your emotion status is calm, and you can hear me really good. And you have a normal posture. And again, your vitals is perfect and everything is regular. And now I want to inspect and palpate both of your hands, nails, cap refills, check for your color pigmentation, and all that good stuff, okay? So there's no lesions, everything's moist, warm to the touch. Color is normal for her ethnicity. Check her nails. I'm gonna check your cap refills and within 2 seconds, and everything looks normal. All right, Angie, now I'm gonna go ahead and check your head and check your hair. So I'm gonna go ahead and wash my hands again and wear some gloves. So I'm checking for any lesions, checking for any lice, any abnormal findings. So I will check it in 3 different spots. Your texture is perfect. There's no lesions, there's no cuts. Your hair is brown, and your head is very symmetrical. And I'm gonna palpate your scalp too, to see if there's any knots. Your hair is distributed evenly, and no evidence of alopecia. I'm gonna go ahead and remove my gloves, and now I'm gonna check your face. It's symmetrical. Your expression is calm and relaxed. The top of the ear is aligned. All right, now I'm gonna check your nose, your pupillar fissures, and your nasal labial folds are aligned with the corner of your mouth. That's pretty good. And now I'm gonna have to check your temporal artery, and I want to go ahead and grade them.
Would it be easier if I took off my glasses for
Please.
you? Okay.
They are 2+, regular and elastic. Now I'm gonna check for the CNM5. So I'm gonna go ahead and I want you to close your eyes, and I want to touch you with sharp or soft, and you tell me which one is soft or sharp. I'm gonna start with your right.
Yes, soft, sharp, soft, sharp, soft.
All right, good. So everything's normal. All right, Angie, now I'm gonna have to check your temporal muscle and minister muscle. So I want you to bite down, and this is your temporal muscle. All right, your minister muscle. Perfect. So everything looks intact and symmetrical. That's awesome. Now I'm gonna do the CN7. I want you to smile for me. I want you to frown. Give me a puff. Can you raise your eyebrows? All right, can you push down on your eyebrows? Perfect. Everything looks good. Facial features are symmetrical. There is no drooping or involuntary movement. Now I'm gonna have to check your TMG. So I'm gonna go ahead and place my hand in front of your tragus, which is right here. Can you please open your mouth? Can you close your mouth? Can you clench your teeth? All right. So I'm just checking for any crepitus. Everything is normal, symmetrical. I'm gonna go ahead and check your eyes right now, okay? I'm gonna go ahead and inspect and palpate your eyes, and check your pupils too, and your eyebrows. All right, your eyebrows are symmetrical. Hair is evenly distributed. There is no visible lesions or scars. There's no cracks, and they're extending. The full width of your eyes is normal. Your eyelashes are evenly distributed too, and they are turned outward. Your sclera is white. I can see that, and it's smooth and shiny. Your pupils are dilated, and the color depends on your ethnicity and in the patient. There's no yellow. That can be, if there's a yellow, that can be a sign of jaundice, so that's good. There is no drooping or of the upper eyelid. Everything looks symmetrical. No sagging of the lower eyelid. No visible cracks or lesions or masses. So your eyelid, can you put your eyelid down and close your eyes? All right, perfect. It is moist and pink. Perfect, it's moist and pink. No drainage. I'm gonna check your perola. So I want to check your eye rounded really quick from the top. All right, your eyelids are moist and pink. So they're clear and not cloudy. They're a size of 3. Perfect. Now I'll be checking your CN 3, 4, and 6. I'm gonna point the pen, and I'm gonna go to different sizes, and you just have to follow with your eye, with your pupils, which is your eye. Don't move your head. Perfect. Everything looks good. You were able to follow and move the pen. Now I want you to, I'm gonna point the pen and move it towards you to see if your eyes will cross, going inwards. So just don't move your head. Perfect. No shaky or motion in the eye. Everything looks symmetrical. Pupils are round, and they're size 3 and equal, and they're clear and not cloudy. So I'm gonna shine the pen light in each of your eye to see for both pupils constrict. I'm gonna turn off the light. All right, I just dimmed the light, so I'm gonna check. Perfect. They react to the light, and they're size 1. So I'm gonna go ahead and turn the lights on. Okay, Angie, when I did your oculomotor, 3, 4, and 6, everything was intact, and that's perfect. So your pupils constrict, like again, there are 3. Okay, Angie, now I'm gonna go ahead and do your CN2. I'm gonna have to ask you to stand up at 20 feet, and you have to read Snellen chart.
Okay.
That work?
Yep.
All right. So the chart is right here. Go ahead and close your left eye. Make sure you're 20 feet. That's perfect. Go ahead and cover your right eye and go ahead and read for
Over
me.
my right? Okay.
Yeah, go ahead and read from. Okay, Angie, go ahead and close your right eye, and I want you to go ahead and read the one that can stand out to you the most.
DEFPOTEC.
All right, your right side is 20/20. Go ahead and do your left side.
DEFPOTEC. P-O-T-E-C.
Perfect. So you're 20/20 in both eyes. This is very good. I want you to go ahead and have a seat for me. All right, now I'm gonna go ahead and check your ears and inspect them. I'm gonna check both of them to see if they're symmetrical, okay? All right, do you have any pain in your ear?
No.
All right, so both of your ears are symmetrical. The color is normal. To her race, I'm gonna palpate the pinna, vocal, tragus for tenderness. All right, there is no tenderness. I inspect your inner ear. I can use the light for that. Perfect. There's no drainage. Okay, so I already checked your pinna, tragus ear lobe is moist. Everything's symmetrical. There's no tenderness or lumps. There is no discharge in the ear canal. But right now I'm gonna hold the otoscope. This is my otoscope. I'm gonna go ahead and change the top, put a new filter on top, and I'm gonna hold your pinna canal upwards, and I'm gonna go ahead and look in this ear. Perfect. I'm gonna go ahead and look at this ear. Perfect. So it is flat, it appears flat, and it is pearly gray in color, and it's perfect. There's no discharge. So good. So right now I'm gonna go ahead and check your CM8, which is a whisper test.
Okay.
All right, so can you close your eyes for me? Or you can keep them open. So I'm just gonna whisper on this ear.
1, 2, 3.
Perfect.
1, 2, 3.
Perfect. So your CN8 is intact. And now I'll be checking your nose. Do you have any trouble with your nose or drainage, any allergies?
No.
All right, so I'm gonna inspect the sputum in the midline, nostril. All right, so there's no cracks or edema or visible lesions. I'm gonna go ahead and ask you to close your eyes, and I want to give you something so you can smell to see if you have good smell sense, and you tell me what it is, okay? Go ahead and close your eyes.
Lemon.
Perfect. It is a lemon. So your smell is really good, and your nasal patency is intact. I will look in both of your nostril with a pen light to see if there is polyps, lesions, redness, and then I will palpate outside by each side to check for tenderness, okay?
Okay.
All right. All right. So your nose looks perfect. It is clear. There is no drainage, and your nostril is intact in both sides. There is no redness or lesions, and I will palpate for any tenderness again.
No.
Perfect. There is no tenderness. Again, you said you're not in pain. All right. I'm gonna go ahead and inspect your deviated septum to see if it's you favor one of the other side. Let me see. All right. It is aligned and symmetrical in both sides. Can you lift your head up for me? All right, it looks perfect, and it looks aligned to your face, symmetrical. All right, and there's no lesions or polyps or redness or discharge. Sputum shows no evidence of any abnormality, and everything looks normal. Can you close one of the nose on the right side, and can you sniff out or breathe in?
Okay.
All right, perfect. Can you do it on the other side? Perfect. It looks symmetrical, and both of them, you can breathe in and out normal. So you don't have a deviated symptom, that's good. All right, Angie, so your CN1 is intact. Perfect. Now I will check your frontal and maxillary sinus. So I will palpate. All right, I'm gonna check under your cheeks right here. And you let me know if there's any tenderness.
No tenderness.
All right, so there is no tenderness, that's good. Right now I'll be checking your throat and your mouth. So I will go ahead and wear gloves. So you're a healthy person. That's awesome.
Well, that's
So-
what I'm here to determine.
Oh, that's good. So now I will check your lips to see if they're moist. All right, I have the gloves on. Can you go ahead and open your mouth for me? All right, your lips are pink and moist. Let me see your teeth. All right, I'm gonna get the pen light so I can just shine and check under your, perfect. Your upper palate is clear and it is moist. Can I check your uvula? Can you open your mouth and say ah? All right, so it is symmetrical to the to your face, so it's in the middle and it moves and it's moist and it is it's midline. Can you move your tongue side to side? All right, sweet. Can you move it up and down? Perfect. All right, so I checked your mouth and checked your lips, but I just want to do just a little bit more investigation here. Can you open your mouth? All right, your mucous membrane is moist and it looks good. I want to check your can you say ah? All right, so it is clear, like I said, and it looks good. All right, again, I did check your CN 9, 10, and 12. Everything's intact, symmetrical, but I forgot to check your teeth really quick. Can you please open your mouth? Sweet, it looks like you have 32 teeth. Your gums are pretty clean and moist and pink. That's perfect. It looks like you brushed your teeth and you floss. That's good. Okay, Angie, when I checked your mouth, I forgot to check your tonsils, but I looked at them in the light, and you don't have no tonsil. Have you got them removed when you were a kid?
Right, yep.
Okay, so perfect. So I will go ahead and notate that because I was kind of like curious about that, but you don't have no tonsils, and that's perfect. And your pharynx is normal, pink color. So now we're gonna go ahead and inspect the neck. All right.
Okay.
I want you to stand. I'm gonna stand in front of you right here. I'm gonna look at your neck. Everything looks symmetrical. There's no lesions. The color is normal to your ethnicity. There's no edemas or knots. And it is, your trachea is in midline. Perfect. Can you raise your head for me? Perfect. All right, one more thing before we check your lymph nodes. I forgot to palpate your lymph nodes, your thyroids and your trachea. Can you go ahead and swallow for me? All right, everything looks intact and good. Now I'll go ahead and check your lymph nodes. I will need to palpate, so I will use my hands to palpate. First, I'm gonna start with I'm gonna go ahead and start with the frontal of the tragus, which is right here. I'm gonna check for knots. Let me know if you're in pain or anything. Okay. front of the tragus. I will check back of the ear, which is the post, behind the neck, acutable, and then the sub under the midline right in here. I will check for the jugular, which is right in here. Superficial, right in here. And I will check for the posterior and supraclavicle. Perfect. So there is no tenderness or knots. That's a good thing. There's no enlargement. Were you in pain when I was doing that?
No, no pain.
All right, perfect. I'm gonna go ahead and check your CN11. I'm gonna test your range of motion. I wanna see your strengths, your shoulder. I wanna tilt your head down, then back to check for any weakness or any abnormal, okay? I want you to go ahead and lift your shoulder up, down. Go ahead and lift your head up. Press down. See if there's resistance. Everything looks good. Go ahead and move your head side to side. Can you go ahead and move it down this way? See if there's resistance. All right, perfect. Now, since I checked for your resistance, I just want to do some range of motion. Can you do the same motions that I told you? Can you lift your head down, lift your head up, side to side, shoulder up and down again? Good. So everything's symmetrical. You have full range of motion. Perfect. Now I want to inspect the posterior chest. I want to inspect, palpate, percuss, and auscultate. Posterior. So I'm going to check the back. Can you go ahead and turn around for me, if that's possible?
Yep.
All right, I'm gonna move your hair this way. Now check your spine. Your spine looks in line and straight. The thorax is symmetrical. And can you go ahead and lean down for me again? Here you go. Go back up. Perfect. There's no lesions. There's no tenderness anywhere. There's no bumps. There's no cuts. There's no sores. Go ahead and lift your right shoulder up, both of them up and down again. Just double check. All right, here you go. Perfect. Okay, so your scapula is symmetrical in each hemorrhoic. Now, I did your respirations earlier, but it seems like you're breathing 16 and regular. You're very relaxed, and now I want you to, I'm checking your spine, so it's normal lateral, no scoliosis and kyphosis. I'm gonna go ahead and palpate. I already palpated, but I'm gonna palpate again for any lumps. And I'll check your skin is very warm and it's moist. I'm gonna go ahead, there's no lesions. I'm gonna go ahead and check. Can you go ahead and just bend a little bit for me? Can you go ahead and breathe in and out? All right, so it retracts. You have a really good posture. I'm gonna go ahead and percuss right now. Go ahead and place your hand crosswards. I'm gonna go ahead and percuss, so I'm gonna go zigzag motion. Perfect. There's no tenderness.
No.
Is there any pain when I was doing that?
No, no tenderness.
All right. Okay, Angie, now I'm gonna auscultate. I'm gonna listen to your lungs. I will do one full breath each area, and you let me know if you're lightheaded, okay? or if you want me to stop. I will start with the upper right and left. Take a deep breath. Take a deep breath. Start in the middle. Take a deep breath. Take a deep breath. Lower. Take a deep breath. Take a deep breath. Now we'll do the sides. Take a deep breath. Take a deep breath. Perfect. So while listening to your lungs are filled equally. I cannot hear any crackles, wheezing, or friction rub or steroids. So you look very healthy and normal. So your lung sounds are perfect. Now I'm gonna inspect your interior chest. So I want you to go ahead and turn towards me, please. So again, I'm gonna have to inspect, I'm gonna palpate and do the same as I did to the back, okay? I'm gonna check for any color. There's no lesions, there's no bumps, there's no cuts. Your skin looks normal to your ethnicity. I'm gonna check for any worm. Perfect, there's no tenderness or lumps. Do you have any pain in your chest?
Nope, I haven't had any pain in the chest.
All right, I'm gonna go ahead and auscultate. I will go ahead and listen to your lungs, and I will do the same as I did to the back. I'm gonna do the upper, and then I'm gonna go ahead and do the lower. I'm gonna go ahead and warm my stethoscope, and I will listen. I will start with the epic. It is in the shoulder right here. I will do left and right. Take a deep breath. All right, I will do upper. Take a deep breath. Take a deep breath. I will do mid. I will do deep breath. Take a deep breath. Take a deep breath. Perfect. Take a deep breath. This is your mid, axillary. Take a deep breath. Perfect. So there is no wheezing. There is no crackers. Everything sounds perfect. Healthy lungs. Your lungs. There's no wheezing. There's no crackles. Everything sounds perfectly. They extend when you breathe in and out. So now I will go ahead and lay you 45 degrees. You can go ahead and lay 45 degrees. So I can check your carotid and jugular. I'm gonna use the pen light. Can you go ahead and turn left for me, your right, and then go ahead and turn. Perfect. So, all right. After looking at your jugular, they're pulsating, and I don't see any distensions. So now I will go ahead and, if you can tilt your head up just a little bit, I'm gonna check for your carotid. I'll do one side by side. I can't do them both at the same time. All right, they're pulsating, and I will say it's a 2. I will do the other one. All right, it's a 2+, and it's pulsating, and now I'm gonna listen with my bell. Go ahead and turn. Perfect. There is no brewer. It sounds pretty good. So right now, after checking your neck, your carotid, I want to go ahead and listen to your heart. So I want you to stay laying flat for me. I will go ahead and auscultate. I will listen to your aortic, and I will start. I will warm up my stethoscope, and I will go with second intercostal space, right sternal border. So it's normal. S1 and S2 are normal, with S2 being louder. I will go ahead and move to your pulmonic, which is right on the other side. Second intercostal space, it's left sternal border. So S1 and S2 are normal, with S3 and they're normal. And now I will move to the third intercostal space, which is the Erb's point. It's right in here. While I'm listening, the S1 and S2 are normal. I will move to the fourth intercostal space, left sternal border. S1 and S2 are normal. S1 is louder than S2. And now I will go ahead and listen to your mortal, which is fifth intercostal space and mid clavicle. S1 and S2 are normal, with S1 is louder than S2. And I will go ahead and listen to your apical pulse for 1 full minute. All right, it is 63. And I will go ahead and do your murmurs right now. So I will go ahead and do the bell. And I will start again. Apical. There is no murmur. I will the aortic, that's the aortic, the second intercostal space. I will go ahead and do the pulmonic, second intercostal space. There's no murmur. I will do the third. There's no murmur. The fourth. There's no murmur. And I will do my last one, the fifth. There's no murmur. So that's good. Your heart is really good. There's no murmurs, and everything's normal. So right now I will go ahead and do your auscultate your check your stomach, your abdominal. So do you have any issues with any abdominal? Do you have any pain?
Nope.
When is the last bowel movement?
This morning.
All right. Do you have any urination or discharge?
Nope.
Regular bowel movement, the color?
Fine. It's normal color.
All right. I will go ahead and inspect your abdominal. The shape, it is flat. You're it's not obese. You're not round. It's a normal shape. Distension. I will go ahead and shine the light and go ahead and take a deep breath. Perfect. No visual of pulsation. And it's in the middle and inverted. No signs of discoloration or inflammation or hernia. It is smooth. There's no scars. Your color is normal to your race. There's no lesions or sores. I will go ahead and auscultate right now in all four quadrants with your diaphragm. I will go ahead and start with the right lower quadrant, and I will go clockwise for vowel sounds. All right. Everything looks, your bowel sounds are active, and I listen between 5 to 30 sounds per minute. I will go ahead and auscultate the aortic. I will use my bell, and it is between the esophagus, xiphoid process, and the umbilicus. So there is no bruit heard, so everything is normal. I will go ahead and percuss, palpate, light. I will start. Is there any pain?
Nope.
I will go up. Is there any pain right here?
Nope.
How about now?
Nope. Nope.
All right, I will do deep palpation. Is there any pain?
Nope.
Tenderness?
Nope. Nope.
All right, I will go ahead and percuss right now. I will do the same technique again, clockwise. And I'm listening for tympanic sounds over the bladder. So it's dull and it's full. Dull if it's full, but everything sounds good. There's no tenderness and there's no pain when I percussed and palpated deep and soft. And it is your artery. I'm gonna check your femoral artery, and it is 2+, elastic, and it's 2+. It's normal. So I'm just verbalizing it. Right now, I'm gonna go ahead and inspect your skin on your leg, on both of your leg. All right. So the skin is smooth, even colors. From your leg to toe, there's no lesion, there's no elastic, normal hair growth, evenly, skin is shiny, no redness that will indicate vascular problem. I'm gonna go ahead and don some gloves. Now I'm gonna go ahead and check between your toes. To see if there's no viscosities in the space between your toes. So I will take off your shoes. I will check between your toes. There's no sores, there's no breakdown. I will check your cap refill, 2 seconds. All right. There's no crepitus when you flex your toes. No swelling or redness. Nails look healthy. No pain, right?
No pain.
All right. No indication of gout or fungus. Your lower extremities are symmetrical. Now I'm gonna go ahead and palpate both of your legs, starting from the top to check for muscle tone and other good stuff, okay? Perfect. So muscle tone is smooth, they're firm, then they're symmetrical, no signs of atrophy, no masses or swelling. Skin is warm and normal, good blood flow and moist, no redness or swelling that will indicate DVT. I will go ahead and check your, see. So it is 0. I just checked them in both legs. Second one. All right, it is 0. So there's no fluids in your leg. Healthy. I love it. Right now, after I palpate it, I will go ahead and palpate your posture, tubula, and dorsal, which is right in here. So I will grade both of them as a 2+, and we'll do the select 2. Two plus. Let's test your active range of motion. So I want you to go ahead and lay down. Are you ready laying down? Perfect. Let's go with the head. Can you, before we start the range of motion, I want you to dorsal, I want to check your dorsal pedis plus, if it's regular. Forgot to do that. Yeah, that's a 2+. All right, let's go ahead and do the range of motion. Go ahead with your hip, raise your leg with your knee straight 90 degrees in both legs. Perfect. Can you do the other one for me? Perfect. So your knees, when you put them up, is there any pain?
Nope.
All right, perfect. Can you go ahead and flex and extend and bend each knee up to the chest, 220 degrees? Perfect. Do the other one. All right, go ahead and we're gonna do some abduction, 45 degrees in and out. Can you start with your, yep, do the other one. Perfect. Is there any pain?
No pain.
All right, I just wanna make sure because I don't wanna hurt you. Now we're gonna do the upper extremity. All right, I'm gonna go ahead and inspect the skin.
You want me to sit up?
Yeah, go ahead and sit up for me. I'll take my gloves and wash my hands. All right, so I will check your upper extremity. Everything looks symmetrical. Your color is perfect. There's no lesions, there's no lumps. Your joints are perfect, and your skin color is good for your race. There's no scars. There's no bony deformities around the joints. No knots, and no arthritis or gout. Perfect. Is this painful or no?
No.
All right. All right. So everything looks good. Right now, we're going to go ahead and check your. Did check your skin if it's warm. It is warm. I'm gonna check your radial artery. They're regular, elastic, and 2+. Let's do some hand range of motion. Can you cuff your hand over your joint to check for crepitation? Perfect. Now finger, hands, flexion, extension. Make a fist. We already did that. Shoulder flexion. Raise your arm in front, up and down. Perfect. Shoulder abduction. Perfect. Shoulder external rotation. We're gonna get the elbow and flex it back to the hands like you're brushing your teeth, brushing your hair,
Okay.
your teeth. Perfect. Let's do the arm strength. Go ahead and push towards you. Perfect. Go ahead. There you go. So it's a 5. Your hand grip is a 5+ for all. You passed the strength test. Perfect. Now we're gonna go ahead and do the check your sensation, and we're gonna neurological system. So I will start with your face. So I have already did the sensation in your face, so we don't have to repeat it again. I did it when I did it earlier when I did your face assessment. I'm just gonna do your arm. Is that fine?
Mm-hmm.
Can you go ahead and close your eyes?
Yep.
Can you feel this?
Yep.
Sharp or soft?
That was soft.
Okay.
Sharp.
All right, sweet. So now we're gonna do some vibration, cool stuff. I'm gonna hold the tuning fork I'm gonna pound it, I'm gonna put it in your feet, and you're gonna tell me when it starts and when it stops, okay? And then after we do that, we're gonna do it in your wrist.
Okay. Start. Stop.
All right. Do it in your other feet.
Start. Stop.
All right. Can I see your wrist?
Yep.
All right.
Start. Stop.
All right. Other wrist.
Start. Stop.
All right. Now I'm gonna check. So everything's normal. You have sensation. Perfect. Now I'm gonna check your biceps, patellar, and tricep. All right. Now I'm gonna take your arm. We're gonna see your reflection here. Perfect. Perfect. You see your elbow right here. Perfect. Perfect. All right. Good. All right. They're normal and they're +2. Now I will check your toes right here. Achilles. Perfect. All right. All right. Now I will take this from the back, the metal, and I will check your consistency for crawling of the toes. All right. It's negative. Negative. And now I want you to stand up. We're gonna do some walking. All right. All right. Can you put your both of your walk on heel to heel, toe to toe, heel to toe. There you go. Perfect. Now, can you walk back on your heel? All right. Can you walk on your toes? Perfect. Everything looks normal. You have good motion. You're not wobbly. Go ahead and have a seat for me. And one more thing. Can you stand up? I want to check that before we sit down. Can you put your hands together, feet together, close your eyes, and I'll count to 10, and I will tell you when to stop to see if there's any unbalance, movement. Go ahead, perfect. Have a seat for me. That's for 20 seconds. We can do it for 20 seconds. Romberg test. That's a Romberg test to observe for any swaying. Now we're gonna do some range of motion to the spine. We're gonna go ahead and do left and right, side by side, and we're gonna twist side by side. So,
Okay, so left to right.
Yep.
Left,
and then to the right,
right,
side
side,
to side.
side.
And then can you bend down for me just a little bit back?
This way and this
Yep.
way.
Everything looks symmetrical, even. She's balanced, and there's no swaying or she's not moving to the right or to the left. Everything looks symmetrical, and you're healthy. Go ahead and have a seat for
Thank
me.
you.
So we just finished our assessment, the head to toe assessment, and I think you did a really good job. There was a lot of questions that I asked. And I'm sorry that took your time, but this is really important to get your every 6 month to a year assessment so the doctor can figure out the changes in your body. Do you have any question for me to ask your doctor?
Nope, I'm good.
All right, I will go ahead and document all my findings, and you're good to go home.
Okay, thank you.
Thanks. And I will open the curtain, I will wash my hands.